Welcome to this week's episode of Hormones, Metabolism, and You. I'm your host, Dr. Cassie Smith. I'm a functional medicine endocrinologist based out of Oklahoma City. This week, I'm going to talk to you guys about hyperthyroidism. So online, tons of people talk about hypothyroidism and Graves, but there is actually 1.2% of the American population, about 4 million people who struggle with hyperthyroidism. And not very many people talk about this. A lot of you have reached out to me, you have questions, and so I brought a hyperthyroidism expert, and we are going to talk all things hyperthyroidism. Just to give you guys a little bit of background information, it's actually estimated that 4.5% of the United States population has hyperthyroidism if you include what we call subclinical hyperthyroidism, meaning that you're not overtly hypothyroid, but you do have some symptoms of hyperthyroidism. So it's a large amount of people. Millions of people, 4 million a year, have hyperthyroidism. And it's, again, just like hypothyroidism, 5 to 10 times more likely that you'll get it as a female. It's actually estimated that 3% of females will have hyperthyroidism over their lifetime. And it most commonly occurs between the ages of 20 and 50. I commonly see it in my practice when women are stressed, when they go to college, when they get pregnant and have babies, when they get married, things like that. So it is pretty prevalent in the United States, 3%. But it is the opposite of hypothyroidism, so it is where our thyroid overworks. And so we are going to talk all things hyperthyroidism today. I have Dr. Eric Osansky. He brings over 15 years of chiropractic care, functional medicine, and nutritional expertise to the field of hyperthyroidism. Just like me, he got interested in this because he had hyperthyroidism and was a patient himself. After achieving remission from Graves' hyperthyroidism in 2009, he's dedicated his career to empowering others to address thyroid and autoimmune conditions naturally. As the publisher of natural treatment solutions for hyperthyroidism and Graves' disease, Hashimoto's triggers, and the hyperthyroid healing diet, he shares actionable insights and evidence-based strategies. So he has 3 books and he talks about them. His podcast, Save My Thyroid, educates listeners on effective holistic approaches to thyroid health, with advanced credentials including a master's degree in human nutrition and functional medicine, certificates as a clinical nutritionist and a certified nutrition specialist, and training in herbal therapy. Dr. Osansky continually expands his knowledge through conferences and specialized courses. Today, what we talked about is we started to describe what is Graves, what is hyperthyroidism. We talked about how do you get it? Like, what are the common reasons people get it? Because that's what I wanted to know when I had hyperthyroidism. What caused this? As we talk about common environmental triggers, stress, viral infections, how your gut affects this, what issues in your gut contribute to hyperthyroidism, and what do we need to do or know about our gut in order to fix our thyroid? We talked about specific pathogens like H. pylori, what lab tests you should be getting. So if you have hyperthyroidism, there are certain lab tests you definitely want to make sure you get by your provider. So we go through all of that. And then we talked about treatment options. So in traditional medicine, we give people methimazole, we give people PTU. We talk about radioactive iodine and how that can actually be harmful, how we don't ideally want to do thyroidectomies. So we talked about some herbal things. He talked about bugleweed, motherwort, lemon balm, L-carnitine, selenium. So just some different things. We talked about LDN. A lot of people ask me about LDN. And just ways that we can help fix our thyroid more naturally. So I hope that you guys find this conversation interesting. I think it's fascinating. There are millions of people who need to hear this. And again, hypothyroidism gets a lot of spotlight, but there are lots of people who struggle with Graves. And that's how I started my thyroid journey 20 years ago. So give this a listen and let me know what you think. Welcome back to this week's episode of Hormones, Metabolism, and You. I have a very special guest today. You guys have asked and asked and asked for me to talk more about Graves' disease. And so I brought on a Graves expert. So I have Dr. Eric Osansky with me, and he's going to talk to you guys with me about Graves' disease. We're going to talk about what causes it. We're going to talk about maybe some environmental triggers. We're going to talk about the gut and how your gut affects it, stress, treatment options, some holistic things. And so just all the questions you guys ask me about, I brought this expert on to talk to you guys about. So I'm super excited about having you. So thanks for joining me.
Yeah, thanks, Dr. Cassie. I'm excited to be here.
So can you start by telling everyone kind of your story and how you got so familiar with Graves' disease and kind of what you do on a day-to-day basis?
Yeah, so my background's a chiropractor, and I was just practicing just as a typical chiropractor. And then in late 2007, I was working out, I was dieting, I was detoxifying. So I was actually trying to lose weight, and I was successful in losing weight. Little did I know that some of the weight loss was due to the hyperthyroidism I developed. But yeah, it went into 2008, and then I was just walking around a retail store and took my blood pressure at one of those automated blood pressure machines, and my blood pressure was fine, but my heart rate was a little bit elevated. It was 90 beats per minute, and I thought maybe it's just because I was walking around. So I took my heart rate, I checked my pulse rate manually in the next few days. It was anywhere between 90 and 110 beats per minute. And I realized something was up, and went to just first a primary care doctor, was diagnosed with hyperthyroidism, eventually an endocrinologist, and got the official Graves diagnosis. And at that point, I didn't have any experience with Graves' disease, and really didn't do anything didn't have much experience from a thyroid standpoint. But as a chiropractor, just like with medical doctors, other practitioners, we have to get our CE credits. And when getting our continuing education credits, I always took nutrition and functional medicine seminars as part of my CE credits. So there were back then a couple of functional endocrinology seminars taught by if you're familiar with Standard Process, and so they still to this day have regular seminars, and so they focus more on hypothyroidism, Hashimoto's, but they did mention that there were natural options for hyperthyroidism and Graves as well. And thankfully I remember that. So when I had my own personal journey, I didn't know if the natural options would work, because again, I was my first my first experience with Graves. But I figured, hey, I'm going to give it a try. There's a cause behind this. There's a reason why I developed Graves' disease. And so long story short, I took a natural approach. I was able to get into remission, and that was back in 2009. And since then, I've been working with others with thyroid, autoimmune thyroid conditions, more so with hyperthyroidism and Graves, just because of my personal experience.
So I love that. Like most people that are doing wonderful things in this world, we kind of get to where we are a lot of times from like a personal experience. And so I think sometimes that makes us a little more empathetic, but it also just makes us more interested, right? And just like thirsty for that knowledge. So you work with patients now still, right? You were telling me you have a practice in North Carolina, but you do a lot of stuff virtually.
Mm-hmm. Yes.
Yeah. And you're more on the realm of helping people holistically try to like heal themselves.
Correct. As we discussed before recording, most of the people who are working with me, they are working with an endocrinologist, at least those who choose to take the medication, since I can't prescribe it. So I do work with people who take the antithyroid meds, which we could definitely talk about. And then there are some people who choose on their own not to take that approach and take a herbal approach when it comes to symptom management, which we could also talk about.
Yeah, and I definitely want to talk to you about all of that when we get there. But yeah, so now I have a new friend, a new colleague in the thyroid space, because we, like I was sharing with you, we take care of a lot of thyroid patients, and so it's good to have people to refer people back and forth to. So I want to start with, a lot of people don't even understand what is Graves' disease, right? So it's an autoimmune condition where your body attacks your thyroid. We get an antibody typically that circulates in our blood, and it makes our body kind of attack. It looks like our TSH molecule, which tells our thyroid to make thyroid hormone. And that antibody will start attacking our thyroid, basically. So eating at our thyroid, which causes our thyroid to make too much thyroid hormone, essentially. And we get too much T4, T3, and we get symptoms, right? Which are opposite of hypothyroidism, which is what a lot of people think about when they think of thyroid issues. So it's kind of like the complete opposite, right? Like it's almost like you've just done too much caffeine or drink too much coffee, where you're hot and you're sweaty. Like you said, your heart rate's high, your blood pressure's high. A lot of times people lose weight instead of gain weight, which sounds lovely until you're walking across the room and your heart rate's 120 and you can't breathe and you're tired and you get sometimes fluid, accumulation, swelling. It can actually affect your heart long-term. It affects your fertility. It messes with your menstrual cycles. It definitely affects your gut. So lots of bad symptoms. But what do you think, like, how do people get this? Like, what is causing this? Is this an environmental trigger? Is it a virus? Is it, these microtoxins, plastic, endocrine disruptors people talk about? Like, why do you think people get Graves' disease?
Yeah, all of the above. I mean, it seems with most autoimmune conditions, I mean, celiac, obviously, it's tied into gluten, but with most other autoimmune conditions, there are different triggers, and there could be multiple triggers. So yeah, I mean, stress in my situation, I'm sure was a factor, and not just the emotional stressors, but I was overtraining, and nothing extreme. Not that, I mean, well, extreme for my body, but I wasn't running marathons or triathlons. It was just going to the gym and not listening to my body, just being wiped out after working out, and but so physical and emotional stressors could play a role. You mentioned viruses and Epstein-Barr. There are a number of studies showing. I know correlation doesn't always mean causation, but there are not just one, but numerous studies, journal articles showing that relationship between viruses and Graves. And then during the pandemic, I mean, I don't know if you experienced this, but during the pandemic, I don't think it was a coincidence that a lot more people came in with hyperthyroidism, Graves, getting exposed to COVID. So yeah, viruses definitely could be a factor, and gut infections, H. pylori, there's that relationship as well. Yeah, the toxins and toxicants are interesting because I think that's a big reason why a lot of people just have, I mean, really not just Graves, but other autoimmune issues as well. Just our world is getting more and more toxic. And I mean, with things like the microplastics and other xenoestrogens, I mean, they not only could affect the immune system, potentially contributing and causing autoimmunity, but they could also disrupt thyroid. They act as endocrine disruptors, so they could disrupt the thyroid and also affect other hormones. And then they could also have a negative effect on the gut microbiome, so which also can play a role in autoimmunity. So yeah, the toxins and toxicants definitely are big factors. Glyphosate is another one, which not so much an endocrine disruptor, but again can definitely cause dysbiosis, imbalances in the gut flora. So yeah, I mean, I talk about four categories of triggers: food, stress, chemicals, and infections, and all of those could potentially be triggers.
So, food, stress, chemicals, and infection. So, what foods?
Well, the big one most people are familiar with, gluten, could be a potential trigger, and not just. I mean, there are some. I don't think there's a lot of research showing this, but I know some talk about like a molecular mimicry mechanism between like gluten and the thyroid. But then even if that's not causing like we got to look at the impact of gluten on the gut. So there's no question that gluten can increase intestinal permeability, and that leaky gut again can be a factor with different autoimmune conditions, including Graves' disease. Corn, actually, you don't hear a lot about corn, but a lot of people go gluten free and they eat packaged foods. It's a lot of times they're getting exposure to corn, and they might say, well, as long as it's not GMO corn, which is true. If you're going to eat corn, definitely GMO free organic corn. But the research does show that corn can cause a celiac like response. So it's similar to gluten. So yeah, I think at least while healing, it's a good idea to avoid corn. I mean, dairy is a common allergen. Again, not really, I can't say there's research showing that that dairy is a trigger, like similar to like gluten and corn, but it is a common allergen, and I do recommend to take a break from dairy while healing. Uh, yeah, I mean, salt, salt has been shown to increase Th17 cells, which are associated with autoimmunity. So not to say having a little bit of sea salt every now and then, it can't be beneficial. But again, you want to be careful, not just for blood pressure, but not overdo it with the salt. And so those are a few examples.
Yeah, so I think a couple things to point out that you mentioned stress for sure, right? Whether it's you're working out too much and not listening to your body, whether it's the mental load that you're putting, your body through. I think that we live in this pretty chaotic environment now, especially after COVID, where we just have a lot of stress. Whether we realize it or not, our brain senses everything that we feel, do, see. And so our brain talks to our stomach by way of our vagus nerve all day long. And so we can get a lot of gut symptoms and issues. And just the stress that we perceive or that's going on can affect our gut, like you said. And so I think that it's really important for people to realize, and that's why we did see a lot of this during COVID. I saw a lot more autoimmunity, Graves, hypothyroidism with Hashimoto's, insulin resistance, like tons of stuff, right? And I do think that stress was a big trigger. So I like how you pointed out viruses, endotoxins, the stress, and then the foods are a big one as well. Gluten, corn is a good one. But I want to kind of transition that into more talking about the gut, right? So stress impacts the gut, food impacts the gut. You mentioned leaky gut. So tell listeners how your gut can actually affect your thyroid. Like, because a lot of people are like, well, that doesn't make sense. How does my gut affect my thyroid? So can you kind of connect those dots for us?
Sure. I mean, there's a few different ways that the gut can affect the thyroid, and both hypo and hyper. So, uh, when it comes to autoimmunity, there's what's called the triad of autoimmunity, and I think I might have mentioned that earlier. So, you need a genetic predisposition, exposure to one or more environmental triggers, and that increase in intestinal permeability, which is a medical term for a leaky gut. So that's one way. Having that leaky gut could be a factor. And then also, most of the immune system cells are located in the gut, like 70 to 80% of those immune cells. So just by that, a healthy gut's important for a healthy immune system. And then some of the conversion of T4 into T3 takes place in the gut. Like you need a healthy gut microbiome, like 60% is in the liver. Think about 20% is in the gut. So if you have a lot of dysbiosis, that could affect conversion of T4 to T3. And then let's not forget the nutrients that are important for thyroid health. Again, more so, like more of a problem with underactive thyroid if you don't have the like iron, and of course the controversial iodine. I don't know if you want to talk about iodine, but a lot of controversy with iodine and thyroid health. But again, iodine is important for thyroid health. If you're really deficient in iodine, same thing with iron is important, zinc is important, so tyrosine is important. I mean, so if you're having a lot of problems digesting and absorbing nutrients, that could also affect thyroid health. So I think those are like four different ways, two of them relating to autoimmunity, and then two potentially affecting directly the thyroid.
Yeah, and I think that's fascinating. It's something that a lot of people don't realize, and I didn't either until I became pretty sick with thyroid issues, how there are certain nutrients that are essential for your thyroid to actually be able to work, right? So you mentioned iron, which I agree with. I check ferritin levels on everyone, zinc. I also, check iodine levels, vitamin D, B12. I mean, a lot of these nutrients are critical for either the conversion of T4 into T3, which is our active thyroid hormone, or being able to actually take T3 into the cell so that the cells can actually use it. Because it's one thing to have the thyroid hormone floating around. I mean, some people don't have it, but if we have it, we still have to be able to transport it into a cell in order for it to work, right? And there are a lot of micronutrients that we need in order for that to happen. And if your gut is inflamed, like you said, you have leaky gut, you have issues with your gut, and you're not able to absorb these nutrients in your gut, then you're not going to be able to make your thyroid hormone work correctly. So I think that's something that a lot of people miss. Most doctors miss this. We don't learn about it in medical school, unfortunately. Even in fellowship, they don't really teach you a lot about this. You also mentioned, leaky gut. Can you kind of talk about, like, let's say I'm somebody who just got diagnosed with Graves and I'm eating a lot of gluten and corn and I have a lot of bloating. How does that gluten and corn, like, what does that do in my gut that, like, triggers all of this? What does leaky gut mean? And, like, how is that affecting this?
Yeah, I mean, great question. So you have, of course, you have the large intestine, the small intestine, so when we're talking more about the small intestine with leaky gut, you have the cells of the intestine, and enterocytes, and I mean, pretty much gluten, corn can affect the barrier, can affect the intestinal barrier, make it more permeable, and when it's more permeable, you could have other things like proteins and, I mean, even infections potentially getting through, causing an immune response, and that's what potentially can cause that autoimmune response. And and there's testing that you could do. I can't say I do a lot of leaky gut testing these days, just because they're not completely accurate, but then also they're not really telling us what's causing a leaky gut. So they're not saying like what is it, the gluten? Is it environmental toxins? So I just assume that people have a leaky gut. And then also if I do a leaky gut, like if I run zonulin and if it's looking good, I'm asking myself, is it really good? Like, does it, is it really accurate? Or so, and everybody's different. I'm not knocking those who test for zonulin. If someone wants to test for it, I used to do a lot of Cyrex labs. I don't know if you know, they have array number 2. So again, I used to do a lot of leaky gut testing, and it's that, I mean, the value of doing it is if you see that you have a leaky gut, you could always retest and then see if it, like, no, if it's normal. One other thing also, though, I forgot to mention when it comes to the gut too, and we could get back to the leaky gut, is a healthy gut is important for metabolizing estrogen, and that could also impact the thyroid too in different ways. One way, nodules. Some studies show that if you have problems with estrogen metabolism, that can make you more susceptible to like uterine fibroids, thyroid nodules. So so that's like a fifth way that gut health can potentially affect thyroid.
Yeah, so a couple of things about that. So we do a lot of gut studies at Modern Endocrine. We do GI maps because if you do, and we do it with zonulin, because if people do have a leaky gut, then a lot of times we can figure out why. There is a marker that tells, do they have a gluten sensitivity? Do they have a food sensitivity? Do they have Klebsiella, Pseudomonas, Proteus, like some of these different bacteria that a lot of people with autoimmune thyroid diseases have. And so I feel like a leaky gut test on its own would not be very beneficial. I do feel like GI maps are helpful because
I
you
agree.
have
I do them too.
way,
Yeah. I do the
yeah, a
GI
way
map as
that
well.
you can actually start to become, have a plan. And I also think it's helpful when a lot of people see me and they're like, well, I don't think I have a gut problem, even though they have every gut symptom. They're like, oh, I'm bloated and I'm constipated and I have acid reflux, but I don't have a gut problem. Okay. But when you show them a GI map and you can show them, hey, your zonulin's really high, your calprotectin's high, your EAP's high, your steatocrit is high, your elastase is low. I mean, you can start showing them all these things. It's like, okay, well, now do we think we have a gut problem? So I think that is helpful. I truthfully think that a lot of times you can't heal anyone until you start with their gut, because your gut, to your point, I mean, it affects your hormone metabolism. It affects the conversion of T4 to T3. It affects cortisol and insulin, which is another thing I think is very important that people forget about in the gut. Like you were talking about the enterocytes and how they can become disconnected or leaky. Basically, the lining of your cells in your gut starts to leak whenever you have foods that harm them, like gluten, corn, dairy, whatever, or endotoxins or viruses or stress. And so when those cells that line your gut open up and start leaking, what happens is that immune system that lives around your gut, right? The 70-80% of our immune system kind of freaks out because it's like, what are all these little particles coming through this tube? And it's normally undigested food particles, right? Or it could be dyes from processed food, right? Red 40, whatever. But our immune system is like, what is all this stuff coming through these little holes? And so our immune system kind of activates, does what it's supposed to do, make sure it's not a virus trying to harm us. But our immune system's chronically doing that. And in doing that, release cytokines and different things. It causes our cortisol, which is a stress marker, to go up. It also causes our insulin ultimately to go up. And then we end up down this rabbit hole of insulin resistance and high cortisol, which then drives our insulin higher. And when our cortisol is high, it affects our gut more, and it affects our ability to make hormones. And then when we can't make hormones, that affects our gut. And so it's just this big mess, right? And I think that it took me a really long time to figure this out, but it's something that is missing in traditional medicine that is so important that we've never been taught. And until you go back and fix that hamster wheel of issues, you just have these patients that are seeing different doctors and getting different treatments given to them for different symptoms, but nobody is really addressing like, where are all these symptoms coming from and how do I make this stop, right? Like, well, take this for this, take this for this, well, what caused all of this, And I think that's what a lot of people now that the internet is so prevalent and that we have podcasts like this and people like you and I are really trying to figure out. That was me 10 years ago, right? It's like, well, I don't want to take this medicine. I want to know what caused this. And so I think that the gut in most circumstances is where you have to look to find that answer.
Yeah, I agree. I agree. The gut is important. I actually have a newsletter, Healthy Gut, Healthy Thyroid. So I think we're on the same page with that.
Yeah, that's awesome. So then I kind of want to transition. So the gut is very powerful. And if you know nothing about your gut, you need to start learning. And if you have a provider, I just want to say, if you're listening to this and you are a thyroid patient and you have a provider that tells you your gut doesn't matter and tells you it doesn't matter what diet you eat, especially when you have autoimmune thyroid conditions, you definitely need to find another provider, because I had 5 of those providers before I found one who understood that no, it does matter what you eat. But I want to transition to lab tests. So people have tons of questions about lab tests, right? So like, if you go to a traditional doctor and you have thyroid issues, you're going to get a TSH. If you're lucky and you see an endocrinologist, you might get a T4. If you're really lucky and you see an endocrinologist and you have Graves, they are usually smart enough to give you a T4 and a T3. And these are free levels, ideally. But most people aren't checking TSIs or TPOs or TRAB antibodies or nutrient tests in general that I know of. What tests do you recommend people get? Like if they come to see you, if they have hyperthyroidism, what tests are you saying these are must-do lab tests?
Yeah, I mean, the blood test you mentioned, definitely I recommend comprehensive blood testing on everybody. So I do the thyroid panel, again, looking at the free hormones like you mentioned, look at the antibodies. So you mentioned I think you mentioned all three, the thyroid stimulating immunoglobulins, which is a type of TSH receptor, and you could test both of those if you want, TSI and TRAb, the thyroid peroxidase, TPO antibodies, and then the thyroid globulin antibodies. And yeah, you mentioned earlier you do an iron panel on everybody, which I do as well. Of course, the basic CBC, comprehensive metabolic panel, lipid panel, vitamin D, extremely important for healthy, not only healthy bones, but healthy immune systems. So I run a 25 hydroxy vitamin D on pretty much everybody, and look at things like CRP, homocysteine, insulin, hemoglobin A1C. So yeah, I mean, I do that on or at least I recommend it on everybody. I mean, I can't say everybody, 100% of people follow everything I say, but those are what I recommend. I recommend, I do like looking at adrenals. I know there's some practitioners who don't like, just assume everybody has an adrenal problem, which is a safe assumption that most people do. But I know when I dealt with Graves, and in that case, I mean, in that situation, I did an adrenal saliva test. Now I still do adrenal saliva tests, but sometimes I'll do Dutch testing, which also looks at adrenals. But if I didn't look at my adrenals back then, I wouldn't have believed that stress was as big as it had as big of an impact as it did, because I felt that I knew stress was a factor, but I thought I was doing a good job of managing the stress. And when I did that adrenal saliva test, everything was low. Cortisol was low, DHEA was low, secretory IgA was low. So I think it's important to do it just to, if anything, just like you mentioned with the gut test. Some people are like, oh, my gut's fine, until you do the test and they see the imbalances. And I find the same with the adrenals. So, I can't say with everybody I do a GI map, but I do a lot of them. And if they don't do a GI map, I do recommend at least testing H. pylori, doing like a stool antigen or a urea breath test, just because that's pretty common with Graves. And also getting back to the blood test, I can't say this is not required, I wouldn't say with everybody, but I do like looking at some viruses like Epstein-Barr, just to see if it is active. And so there's like 4 different markers associated with Epstein-Barr. So I will say if Epstein-Barr is positive, I don't always treat it. Usually I'm doing things to optimize immune system, just because I look at it more as an immune system issue. If someone has we're not going to get rid of Epstein-Barr, but sometimes I will use it. It's not like I'll never use antiviral, herbs or homeopathy. But I like organic acids testing. I can't say I use that again on everybody. Same thing with Dutch. Like I like Dutch testing. Sometimes I'll just do adrenals, and if I want to focus on adrenals, I might just run an adrenal saliva test. But depending on the health history of the person, I might recommend a Dutch test to look at the hormones and how they're metabolizing the hormones. And yeah, those mold testing, again, can't say across the board, but again, and that's the thing with mold, you just never know too. Like we can make the argument that we should be, and I don't know your approach with mold, but again, we could say maybe everybody should get a urinary mycotoxins test, because mold could be hidden behind walls, underneath the floors. But usually, again, I'll see with the health history. Same thing with like stealth infections. I was personally diagnosed with chronic Lyme and Bartonella. This was after my Graves experience, and I wasn't having the typical Lyme symptoms. I was having more neurological symptoms, and the primary care doctor actually didn't want to test me for Lyme. So again, I use the health history to kind of determine what testing, but in most people, like I said, or pretty much everybody, I'll recommend comprehensive blood testing, adrenal testing. Sometimes you mentioned nutrients. I usually try to do what I can through the blood, but then there's tests like Genova Nutraval that sometimes I'll recommend that also looks at organic acids. So yeah, those in a nutshell are some of the more common tests.
Yeah, so I think from a blood test perspective, if you're listening to this and you're a thyroid patient, a TSH, a free T4, a free T3, a TSI, especially if you have Graves, a TRAB antibody, a TSH receptor antibody, and then TPO is really important as well, I think even in Graves, because there are a few subset of people who get Graves, and then once they go into remission, which we're going to talk about, they can flip and become hypothyroid. And they can go back and forth from Graves to hypo. And that is not fun. That was actually me. But I think TPO antibodies are important as well. If you have a provider who tells you, especially with Graves, that you don't need a free T3 and a free T4, you definitely need to run and find a different provider. And then I do think, like you said, iron, vitamin D, B12. I mean, we check a lot of these labs. I like CRPs. I like looking at adrenals. We do cortisol levels. We do blood tests because it's easy to get a baseline. We do salivary at times in urine. I think insulin is important. So all these things are very important. Hormone levels, because they all play together. And so we have a pretty extensive, about 30 labs that we check on all of our new patients, because I think it's not fair and impossible for you to ask me as a patient, hey, can you fix me, without knowing truly what's going on? Because all of our endocrine system works together. Our thyroid works with our hormones work with our adrenal works with our insulin. All of that affects our weight. It all affects our gut. It all affects our mood. It all affects our sleep. Our growth hormone is very important. We look at that. And so it's just really egocentric to think that you can fix someone without having all of the information, I think. And that's why we have millions and millions of people who are still sick in this world. That's why our healthcare system is a train wreck in this country. And that's why, people are searching for things like this, like you and I, people who think outside the box, people who think not the way traditional medicine taught us to think. Now, I also want to talk about, you were talking about H. pylori, and I completely agree with that. We kind of skipped over that in the gut section. I see a ton of people with thyroid issues that have H. pylori. And to your point, a lot of times I'll know this because when we get their labs, they have extremely low ferritin levels. People who shouldn't, people who aren't menstruating, men, women who are postmenopausal, who have negative fecal occult bloods or have had colonoscopies. Like, there's no reason these people should have low ferritin. Ferritin is a measure of iron, right? And so it can be low if you're bleeding, right? If you're having menstrual bleeding, if you're having rectal bleeding, whatever. So a lot of women will struggle with this, and you struggle with this when you're pregnant because your baby needs iron and it leaches it from you. But when you have somebody who has thyroid issues and has very low ferritin levels and you don't have a good explanation, I always think about H. pylori, because H. pylori will eat and bind up iron. But H. pylori is also, you said, a very common trigger or issue with thyroid disease. So can you explain that a little bit? Is that also like Proteus, Klebsiella, some of the bugs that we get that overgrow in our gut? But what is that connection, the H. pylori and thyroid issues?
Yeah, the research actually with H. pylori also talks about a molecular mimicry mechanism. And again, for those who are not familiar with it, that's where, it shares a similar amino acid sequence to the thyroid. So the body, instead of it attacks not only the H. pylori, but attacks the thyroid. And so that's, again, it's, I guess you could say theory, but there's, again, multiple articles. If you do a PubMed search on H. pylori and thyroid health, because it's not just Graves, but even with Hashimoto's, there's that relationship as well. But then also potentially it could affect the permeability of the gut as well, which we already mentioned. And then Yeah, you brought up, which is really important. I mean, stomach acid. We need stomach acid to break down our proteins and break down our minerals. And we already spoke about the importance of minerals when it comes to the thyroid. And, of course, they have so many other important functions. And, of course, we know that how important protein is. So arguably the low stomach acid also is not really good from a overall health perspective and can be a factor as well.
Yeah, 100%. And low stomach acid and H. pylori are huge triggers for a lot of issues in this country: esophageal issues, Barrett's esophagus, increased risk of colon and stomach cancers. And it's a big deal. And that's one of the reasons I like the GI map too, because you can look for fusobacterium, right? And there's been a huge correlation between increased fusobacterium and colon cancer, especially in younger people in this country. So, but traditional medicine says when you have acid reflux or H. pylori, we just give you a PPI and kick you out the door, right? Because that shuts you up and gets you out of the clinic.
Yeah.
But that's not. I mean, PPIs were made to take for 14 days, not to take for 14 months or 14 years. And so that's another big pet peeve that I have, and I could get on a soapbox about that. But if you're on a PPI medication, you've been on it for years, that's not necessarily a good thing, right? Like, we need to be figuring out why and fixing that, not just continuing to band-aid and over-medicate a problem, in my opinion. So.
Agreed.
So then I want to transition to treatment, right? So we briefly talked about this, but I have a ton of people who ask me, right? So the medical treatment, the traditional treatment for Graves' disease is: number one, methimazole. Number two, PTU. One or the other. These are medications that block the ability of that antibody to stimulate your thyroid to make more thyroid hormone. The other option that a lot of people talk about is radioactive iodine, which I think is a terrible, terrible option, but they teach you in fellowship even, like, this is a good option. It was what was pushed upon me whenever I had Graves, and I said no, and so I was fired as a patient from several doctors. Which I'm still glad I got fired. That was the best thing I ever did for myself, because radioactive iodine has its issues. You can surgically remove your thyroid. So there's kind of three buckets, right? There's like these medications you can take, there's radioactive iodine, and then there's surgery. But I actually think there's a fourth bucket, and that's what I wanted to talk to you about, which is more of this approach of, let's see if we can calm down this autoimmune issue and like fix this from a more holistic supplement perspective, right? So I want you to talk to that. Like, if somebody's listening to this and they're like, hey, I would like to do this more naturally. With the caveat being, I think you and I both agree, like, if you are floridly hyperthyroid and have significant Graves, meaning your heart rate is above 130, your blood pressure is super high, I mean, you're having issues breathing, walking, etc., this is not for you, right? So you have to do this with under some medical supervision. But talk to us about how you can treat Graves' disease in a more like natural, holistic approach. And do you think that LDN is a good option?
Sure. And yeah, I agree. There's definitely a time and place for the methimazole, for the PTU. And I mean, there are some people who are stubborn. And again, I'm one of them too. But like I said, I was open to taking if I absolutely needed to. So we want to be safe while trying to address the cause of the problem, while trying to heal. But yeah, so when I took those continuing education credits, I learned about the herbs bugleweed and motherwort. So those are what I personally took. And bugleweed is an herb with antithyroid properties, obviously not as powerful as the methimazole or PTU, but which is good and bad. I mean, it doesn't work in everybody, but it also doesn't have the side effects that the meds have. And so when I took bugleweed, again, that was my first experience. I never knew anybody else who took it for hyperthyroidism, but I noticed relatively quick that it was helping with my heart rate, and then eventually with the blood test when I retested. But even before that, I knew it was working. I was still having palpitations though, so I took motherwort, which again, it's not the same as a beta blocker like propranolol or atenolol, but I call it kind of like a natural beta blocker because it's affecting the cardiovascular system. I mean, it has other benefits as well, motherwort. But so I took the bugleweed, I took the motherwort, and those worked amazing in my situation. Another one that's well known is lemon balm. Lemon balm has a calming effect, and I don't find it to be as effective as bugleweed. It seems like it has more mild antithyroid effects, but yeah, I mean, that's like if someone is experiencing anxiety or sleep issues, they could try taking it at night or drink some lemon balm tea. But then L-carnitine. L-carnitine is very interesting because there's also a decent amount of research. When I say decent, not like hundreds of studies, but again, there's a lack of studies in the hyperthyroid space when it comes to natural agents and L-carnitine. I think there's 4 or 5 studies, which to me is a lot when it comes to hyperthyroidism. And and I don't agree with one of them. One of them actually says that it's been shown where it might be used like in the case of a thyroid storm, which to me, I would not take L-carnitine or recommend L-carnitine if someone was having a thyroid storm. But it seems to block the entry of thyroid hormone into the cell, like at least in higher doses, like 2 to 4,000 milligrams, 2 to 4 grams. I don't know if you saw in 2000, just recently, August 2025, there was a study that showed that only 500 milligrams of L-carnitine combined with only 83 micrograms of selenium in a small study involving Graves patients actually helped them to, these people were taking methimazole, so they needed a lower dose of methimazole, and it also helped to lower the Graves antibodies. Probably more so the selenium, I'm thinking, had that impact on the antibodies because there are other studies just showing selenium having that impact. But yeah, there are, for some people, the natural options are a way to avoid the medication. And again, I can't tell someone not to take the meds, or, if someone chooses it on their own, if they're seeing me and they're not taking it already, that's great. If they're having a reaction, they stop taking it on their own because the doctor is saying you need radioactive iodine thyroid surgery. Again, I'll talk to them about bugute and motherwort. But yeah, those are some of the more natural options for managing the symptoms of hyperthyroidism. And I could talk about LDN. I didn't know if you have anything before I speak about LDN that you wanted to
Well,
say.
can you tell people if they were wanting to do bugleweed, what dose of that did you take? Do you recall?
Yeah, yeah. I took and there's different like extracts. So I personally took MediHerb, which is based out of Australia, but Standard Process is a distributor. And that's probably why they spoke about bugleweed, or not probably, like years ago when I took their CE credits, because you know how it works when you take the CE credits. If you take one from a supplement company, of course they're going to talk about their supplements. So they spoke about
Right.
their bugleweed and motherwort. But I took a teaspoon of bugleweed twice per day, and I took a teaspoon of the motherwort twice per day. Um, I can't say everybody I put on the same dose. Like motherwort is more based on the symptoms. So motherwort, for example, you might maybe only need like half a teaspoon twice per day.
Yeah.
Back then, I didn't know as much about the herbs as I do today. So same thing with the bugleweed. Someone might only need like 2.5 milliliters twice per day, or again half a teaspoon twice per day. Some people might need to take it 3 times a day, depending on the situation and the
And then
levels.
the lemon balm, you mentioned tea, but is there like a way you can take that in a pill form?
Yeah, well, there might be. I know there's an extract. There's like some companies that have the extracts, like Herb Farm. Um,
Okay.
and usually with that, I'll just say like take a teaspoon before going to bed. I mean, Herb Farm comes in dropper fill, so some people just follow the recommended dose and just take like a dropper fill, which is less than like a teaspoon. But
Yeah. And that's sort of like, treating with pharmaceutical drugs too, right? So whenever you prescribe propranolol for hyperthyroid symptoms, I always write on there 10 milligrams every 4 to 6 hours as needed for hyperthyroid symptoms, right? That may mean you need to take it every 4 hours. That may mean you need to take it once a day. That may mean you take it, once a week. So
yep.
it's similar. So bugleweed, motherwort, lemon balm, and L-carnitine. So talk to me though about LDN.
Yeah.
Is it
So
good? It's great for Hashis, I will say that. But what experience have you had with Graves?
yeah, I mean, I've seen mixed results more with Graves. It's just for whatever reason, I can't explain why, but it does seem like it's more effective with Hashimoto's than with Graves. And I've spoken with others who have, I mean, again, not everybody necessarily, but as you know, not a lot of people see Graves. So I can't say I've spoken with practitioners who have a lot of experience Graves. So I'll be curious to hear what you have to say. But yeah, I think it's more hit or miss when it works. it could work well. And I mean, the good thing about LDN, I mean, side effects are not as common as the methimazole. Like some people have sleep issues, and that sometimes they could just not take it at night, and that might not, or sometimes people just adjust to it. But definitely not as bad as the PTU and the methimazole. And then again, it's affecting immune system, and Graves is more of an immune system condition than a thyroid condition. So I guess the one downside is, and again, I guess it depends on the perspective, because there are some people who would take LDN continuously. Like if it's working, they'll be like, you know what, I'm good just taking it. I don't need to like address the cause of the problem. Just, give me the LDN. But if we're doing things to try to address the cause of the problem, and if someone's taking LDN, then we kind of don't know. Whereas like if they're taking the methimazole or PTU, we kind of know because they'll start becoming hypo. And like you said, sometimes that could be because they also have the Hashimoto's antibodies. But again, so we need to factor that as well. But with LDN, to me, it does make it a little bit more challenging to see if someone's in remission, because it could be the LDN that's modulating the immune system and causing those antibodies to normalize. So I like it. It's not my first, like if I were able to prescribe it, and even though I don't have prescribing rights, it's easy to refer to someone who does prescribe it. So if I wanted to, I could say everybody take LDN, just go do a remote call, because there's a lot of those out, practitioners doing remote calls for LDN. But like I said, to me, it's if someone is, I think LDN, if someone, let's say, is unable to tolerate the antithyroid medication and the natural agents just aren't working, because again, they don't work with everybody, I think LDN is worth a try. I don't know if you're familiar with cholestyramine. So cholestyramine, I've had a few endocrinologists. It's not always easy to get them to prescribe it, but and it's not me who's talking. I just tell patients, show them the research, even though the research says it could help with mild hyperthyroidism. I've had some patients where where the thyroid hormones are severely elevated. They took the cholestyramine, and they were able to avoid the radioactive iodine thyroid surgery. So can't say it's been a large sample size, but those would be two options: LDN, cholestyramine, if your endocrinologist is saying you need radioactive iodine thyroid surgery just because you can't tolerate the antithyroid medication.
Yeah. So I think that's a good point too, is again, like we're not trying to give you medical advice. But we're just giving you options. And so a lot of people take PTU, methimazole. I prescribe it for people. You try to do a high dose at first to get them in remission pretty quickly. You lower the dose very quickly. I try to get people off of it as soon as possible. And there are people who need this medication because they are very sick. And it's way better than radioactive iodine or surgery, in my opinion, But in people who can't tolerate these medications or want a different option, these are some different options. I don't have a ton of experience with LDN going well with Graves, to be honest with you. I have a ton of people with hypothyroidism in Graves, though I think there's just so many things going on. I personally think if you want to look at Graves from a more holistic approach, I like these supplements that you've talked about. I think that is a good idea. You can take propranolol, the beta blocker, to help with the symptoms. I like looking at the gut, so making sure we're doing everything to clean everything we talked about, like fixing your stress, fixing your sleep, fixing, any sort of infections you have, fixing your gut, those things will all help make this better also, right? So you have to remember, I kind of like to think of autoimmune diseases just like I think of cancer. Anytime something is going awry in your body, it's probably because the environment in your body is toxic, right? And so people don't like to think that, but it's true. When your body senses stress, when your body is under large amounts of stress, when we're maybe not eating like we're supposed to, or working out too much, or not sleeping right, our body can't do what it's meant to do, which is heal us and keep us healthy. And so a lot of times going back and just taking a really good, truthful, checklist of what's going on and how we're treating ourselves is a lot of times pretty eye-opening too, right? And so I think that all these things are great things for people to have in their pocket and to determine with their provider what is best for them. But I just wanted people to have some of this information. And again, I think that sleep, stress, gut, movement, sunlight, all these things are very important too, right?
Yeah, definitely agree.
So I want to kind of start to wrap up with a couple of things. Number one, I want you to tell listeners, like, what is the key takeaway they should take away from this? If they're listening to this and they just feel overwhelmed because maybe they have Graves or they can't find a provider that will get them, you know, the labs they want, or just what is the key takeaway to somebody listening to this? Like, what do you hope people take away from this?
Yeah, I mean, I always tell people that there's hope because unfortunately, and you know this from your experience too, most endocrinologists, like you said, they're not open to, they'll tell you that diet's not going to change anything, and they do the opposite. They scare the patients, and usually they end up getting radioactive iodine thyroid surgery. Yeah, it's so there's hope, and just really trying to find the right practitioner. But even before that, there's a lot of things you could do on your own. You just mentioned, I mean, we spoke about diet, and you mentioned sleep and the stress management and movements. I mean, the foundations of healing. So you definitely want to do those regardless of what your endocrinologist tells you. And yeah, and then yeah, I mean, do that, work with a practitioner, and just just keep in mind that it's very common. You might go to, I mean, a few different practitioners, especially, again, not to, since you're an endocrinologist, but you're not a typical endocrinologist. But I've had people where they say, well, I've gone to, 3 endocrinologists and all saying I need radioactive iodine and thyroid surgery. And, I just tell them, remember, I'm not saying there's never a time and place, especially for like surgery. I'm with you, the radioactive iodine, I can't say there's a time and place for that, but again, this is an immune system condition, so the surgery is not addressing the autoimmune component, and the research clearly shows that if you have one autoimmune condition, you're more likely to develop others in the future. So I would, even if someone got the surgery and they listen to this, and they have Graves, you still arguably want to do things to optimize the immune system. But yeah, the one key takeaway is that there's hope. Incorporate the foundations and work with a practitioner who has an open mind.
Yeah, and I would also say radioactive iodine a lot of times will make that autoimmune stuff worse. So if you've gone to 3 endocrinologists and they've all told you the same thing, find a 4th one.
Especially the eyes. You've seen that the thyroid eye disease, like there are people that have mild thyroid eye disease, and so because if someone has overt thyroid eye disease, usually the endocrinologist won't recommend it. But I've known people where they had mild TED and then they got the radioactive iodine, and then all of a sudden, they had severe TED, and so that's exactly. That's another reason not to get it.
And TED is thyroid eye disease, yes. So I agree. So basically your takeaway is don't give up, keep trying to find someone who is holistic, and always be your own best advocate, and I completely agree with that. I'm going to ask you 3 questions. This is going to be rapid fire quickly. First thing that comes to mind, but I ask everyone this. What is one food that's most beneficial and why?
All right. I will go with avocados. Just it's a healthy fat. Now, again, I can't say I eat them every day, but I do try to incorporate them into my diet, usually adding it to a smoothie. But yeah, I'll go with avocados.
I love that. What is one thing that's 100% free that anyone listening to this right now could do for their health?
Deep breathing. Every day, though. You want to do it every single day. Let's say mind-body medicine is free, so it doesn't have to be deep breathing, but incorporate some type of mind-body medicine on a daily basis.
And what is one thing you wish you would have known about your health 20, 25 years ago prior to you getting Graves' disease, and what would you have done differently?
Yeah, I mean, I guess I have to go with the stress. Just underestimating or overestimating my stress handling skills, I guess you could say, and just not listening to my body. So both the physical and emotional stressors. So that's, I think most people who follow practitioners like us and try to take a natural approach, they understand that diet is important. And again, some do understand the stress, but I still think people aren't focusing enough on the stress management. And I mean, because we're always going to deal with stressors in our life, and we're not going to be able to get rid of all the stressors. So it all comes down to how we perceive the stressors and what we do to improve our stress handling.
Okay. Well, Dr. Eric, I commend you for going outside the box, being different, trying to help people actually heal and get better. Will you tell people, I know we're going to share a link in the show notes about one of your free opt-ins, savemythyroid.com. It's a thyroid immune checklist. But where else can people find you? How else can we support you if we want to learn more about you?
Yeah, so like savemythyroid.com, they could find out more about me. And I also have another website, naturalendocrinesolutions.com, which has a lot of articles and blog posts. And then I have 3 books, 2 of them related to hyperthyroidism, natural treatment solutions for hyperthyroidism and Graves' disease, the hyperthyroid healing diet. And then I do have a Hashimoto's book. I had to write a book on Hashimoto's in 2018, the Hashimoto's triggers. So you could find those on Amazon. And yeah, I have a newsletter, Healthy Gut, Healthy Thyroid, which you could check out, savemythyroid.com/newsletter. So yeah, I would say those. One other thing, if I could say, I also have a Healing Graves Naturally school community as well, which is so I have some Facebook groups as well, so if you want like Facebook. So yeah, but you could find this all savemythyroid.com.
And you have a podcast too, don't you? Did I make that up?
Save my thyroid. It's called Save My Thyroid. So yeah, if you visit savemythyroid.com, you'll find that as well.
Okay. Well, thank you so much, Dr. Eric. We appreciate you coming on and helping us answer questions that so many people have about Graves, because again, hypothyroidism and Hashimoto's kind of gets all the hype, especially online too. And so I know there's a lot of people out there who had a lot of questions about this. So I'm glad I could finally track you down and get some of these answered.
Yeah, well, thank you, Dr. Cassie. Again, this was a great conversation. And yeah, again, great chatting also with an open-minded practitioner, open-minded endocrinologist, and definitely will, send some people your way.
Awesome. I hope you enjoyed that conversation with Dr. Osansky as much as I enjoyed recording it. I do think it's packed with educational information. I hope that you feel validated, more empowered if you are a patient struggling with hyperthyroidism and you have some answers as to what labs need to be done, ways that you can work on this holistically, why your gut matters, different things like that. I know that I wish I would have had something like this whenever I was in medical school and got diagnosed with hyperthyroidism years ago. And so if you found this educational, informational at all, please share this with other people. That's why we do this. If you know anyone with thyroid disease or somebody that's struggling with thyroid issues, please share this episode with them. Make sure that you are following us on social media. I give a ton of free education. Also, if you want me to talk about something, that's how you tell me. Follow me on social media. Let me know. I'll find guests. I'll bring them on. I'll educate you. Please remember that Modern Endocrine has a medical license in 43 states. So if you're struggling with this, if you listen to this and you're like, that's me and I need a different endocrinologist or I need a different provider, find us, Modern Endocrine. We have a license in 43 states. We do virtual visits. A lot of times we can see you within a week or two. And so we would love to help you find a more holistic approach if it's safe, but you need to work with a provider who understands this. So find us. We're happy to work with you. That's what we love doing. And make sure that you leave me a review as well, if you don't mind. Reviews let me know that you love what we're doing. And tune in next week. Follow on social. We got a lot of good stuff coming this month and early next year. Have a great week.